Hi, Marty. Nice to see you.
Hello, Millie.
Um, Starting off, why don't you tell us about yourself?
Well, let's see. I come from Brooklyn.
Hmm, I did not know that.
So I've been a licensed marriage and family therapist for 44 years and certified sex therapist. I'm the award-winning author of 7 books about sexuality. And what else? I see couples and individuals. And I have given 2 congressional briefings about evidence-based sex education. And I do uh, expert witnessing for state and federal courts in areas of sexuality areas, obscenity and sex offenders and fantasy and pornography and paraphilias and most areas of sexuality. That's very challenging work.
Well, a lot of interesting work, a lot of experience. Kind of going to the topic of what the training will be about. What's one thing most people get wrong about infidelity?
Oh, I'm so excited that I'm doing this training, Millie. I'm so glad to have a chance to talk about it. Uh, so we're going to do a whole training just on infidelity, and I call the training after the affair, who owns the relationship? And that's to address one of the main problems that I see with the way that our field deals with infidelity, which is that the aggrieved party, or let's call them the betrayed, that person acquires an enormous amount of power in the relationship as a result of having been betrayed. And in my observation, we don't give nearly enough attention to the voice of the person who has done the betraying, the person who had the affair, the person who was unfaithful. All these terrible judgmental words, right?
Yeah.
So one of the misconceptions in our field is that uh, the person who's been betrayed, because they're so upset, because their hair is on fire, that's the person that we need to focus on. That's the person we need to heal. That's the person that we want to make sure that they have enough of their voice. And indeed, that person needs enough of their voice. However, in every other arena of couples counseling, no matter what the content is, money, health, parenting, whatever it is, we always make it a point to be neutral and to consider the points of view of both parties. We should be doing the same thing when it comes to infidelity.
That is a really good point. And what do clinicians often miss when working with clients navigating infidelity?
Well, a lot of therapists assume that infidelity is about sex and that infidelity is about one person being selfish. And while a lot of affairs start out being about sex, they don't always continue being about sex. Sometimes they're about feeling connected or being known or seen or heard. Um, and in terms of selfishness, because of the culture that we live in, we tend to privilege certain kinds of promises over other kinds of promises. And one of the promises that we as a culture and we as a field really privilege is the promise of sexual exclusivity or sexual fidelity. And I'm a big believer in you should keep your promises. If you don't want to keep your promise, don't make a promise. But if you're going to make a promise, keep your promise. That said, when there's been infidelity, it's such a showstopper
Mhm.
that sometimes we don't ask about what other promises or what other implied promises, what other agreements have been broken in this couple or stretched in this couple. So, for example, um, if one person becomes so engrossed in their hobby that they abandon their partner emotionally, or one person gets so involved with their new baby that they abandon their partner emotionally, or they're so tired because they're always going to city council meetings that they don't have any time to be with their partner. As therapists, we tend to not take those broken promises as seriously as the broken promise of infidelity. And what I observe is that uh, when someone's at the receiving end of that kind of a broken promise, they take that pretty seriously and they're pretty upset. Is that an excuse for infidelity? It's not an excuse. Sometimes, though, it's an explanation.
Yeah, I've heard people talk about how it's a co-created dynamic, and yeah, a lot of aspects of those dynamics can be forgotten when there is a lot of hurt and things. But yes, very good points again. How is the idea of getting back to normal after infidelity a myth?
Well, you know that old expression, forgive and forget.
Hmm.
People forgive, they don't forget.
Yeah,
Nobody, nobody.
nobody forgets.
And there are certain events in people's lives, and there are certain events in couples' lives that uh, represent a turning point or a transition in the life of that person or the life of that couple. Maybe being diagnosed with a chronic illness is an example. Maybe going bankrupt is an example. Maybe getting a DUI is an example. And another example is infidelity. So a couple can get over the infidelity, a couple can heal from the infidelity, a couple can even emerge stronger from after the infidelity than they were before that, but they don't go back to quote unquote normal. The old normal is gone. Whether people get along afterwards or not, the old normal is gone. Whether people reestablish a sexual relationship, the old normal is gone. And we shouldn't be encouraging couples to imagine that at some point, if they both do enough work and if they heal properly, that they're going to go back to normal. That old relationship is over. Now the question is, what new relationship, if there's one at all, what new relationship are people going to build?
Absolutely. And it also seems just like a lot of unnecessary pressure to get back to normal, too.
Yeah, yeah.
Um,
You know,
oh,
Millie, that a related thing to that is, I don't assume that every couple should reconcile after infidelity. Now, I also don't assume that every couple should split after infidelity. Every couple
mhm.
is different. Is infidelity a good enough reason for people to split up? That's up to the individuals. What I do know is that making a really important life decision when you're really, 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 really upset is
Mhm.
almost never a good idea. And that's what some people do. 5 minutes after infidelity is discovered, they say, oh, that's a red line. The relationship's over.
Yeah.
If you're in a state of mind where you wouldn't buy a new car, if you're in the state of mind where you wouldn't decide whether or not to have a baby, you
Mhm.
probably shouldn't be deciding whether or not to end a relationship.
Yeah, it's such a huge decision. And yeah, there's so many like speaking of pressure, like cultural narratives of like what you should do or not do, and maybe that's not even what you really want. So yeah, that's such a good point and something that can be really helpful in therapy to talk about.
And
Um,
social media is not our friend here because uh,
no.
it's real easy to find websites. My husband is a lying, cheating son of a bitch.com, right? Or
Yes.
it's real easy to find Reddit forums about what kind of a woman would stay with a guy who cheats on her.
Yeah.
Uh, that's just not helpful.
No, no, it doesn't like pertain to your situation and it's all noise.
It's all noise.
And what do many people misunderstand about desire after betrayal?
Well, for some people, sexual desire goes down after infidelity. And if sexual desire was an issue before infidelity, this could actually make things even more difficult. On the other hand, for some people, after infidelity is revealed, sexual desire goes up. Um, People are maybe more honest with each other. People feel more appreciative of whether or not they're going to lose the relationship. So desire can change in either direction.
Mm.
The most important thing is for people to realize that that change may be temporary, maybe so don't take it too seriously at this very second. And the other thing is that it's really important to talk about it.
Yeah, the communication piece. Well, even going back to what you were saying, where it's like a new normal, or not going back, rather to the old normal, this could be an opportunity to change things, potentially for the better, even.
Right. And not only around sexuality, but
Yep.
as you said, about communication, about what is the vision that each person in this couple has about what they want out of being in a couple.
Yeah, absolutely. Um, what about, let's talk about with porn and infidelity. Is porn use a form of infidelity? And now, what about chatbots? What about AI?
Well, Is porn use a form of infidelity? Is a question I get from somebody or other pretty much every week in the office now.
Okay.
Everybody, what we know is that lots and lots and lots of people look at porn,
Hmm.
and lots of people are upset about their partner using porn. Um, Infidelity, what is the definition of infidelity? Infidelity is a contract violation. It's a contract violation. If the contract is we're going to be sexually exclusive, and somebody goes and they have sex with somebody else. Now, of course, how you define sex, that's its own question, right? But
Yeah.
if somebody goes off and has sex with somebody else, well, they've obviously violated the contract of we're not going to be sexual with other people.
Mhm.
What is the contract that most couples have about pornography? Well, hardly anybody ever couples up and says, oh, and by the way, you're not going to look at any porn now that we're going to be living together, right? Nobody says that. Or
Yeah, no
nobody
one really talks about, or a lot of people don't talk about it.
Nobody talks about that. Nobody says, let's move in together. However, even though we live together and we have sex together, of course, I'm going to want to look at porn once or twice a week or once or twice an hour, or once or twice a year, whatever it is.
Hmm.
Nobody talks about that. So there's no explicit contract about porn use. And when people say, you're looking at porn, that's a form of infidelity. What people are saying is you're looking at porn, you're breaking a contract that we have. And the porn consumer can very rightfully easily say, excuse me, we don't have a contract here. I'm not breaking any rules here.
Yeah.
Now, what couples want to do about this in my office is they want to argue about whether or not it's infidelity. And people can argue about that for the entire 50 minutes and come back the following week and argue about it some more.
Hmm.
What I do is, what I say is, the question is not, is this a form of infidelity? The question is one of you uncomfortable about what the other one is doing? And if one of you is uncomfortable about what the other one is doing, you guys need to talk about that. That's the way that we handle things like, I don't want you riding a bicycle without a helmet, right? Or I don't want you uh, uh, going window shopping when you've agreed that we are not going to spend any money this month.
Hmm.
That's how couples ideally deal with you're behaving in ways that I don't like. Hopefully, nobody says, hey, we don't have a rule around here about whether or not I wear a helmet when I bicycle. So if you don't like it, tough luck on you.
Yeah.
That's not the way a healthy couple would deal with that, right?
No.
So it's the same thing. The question is not, is it a form of infidelity? The question is somebody uncomfortable with it? And if your partner is uncomfortable with what you're doing, then you guys need to talk about it. That doesn't mean that
Yeah.
you do everything your partner wants you to do. But step one, acknowledge that your partner is unhappy with what you're doing. And step two, find out what it is about what you're doing that they're uncomfortable about.
Yeah, it's like understanding each other, like starting there. So why do you say that both partners in a couple need to be more curious after infidelity is revealed?
Well, infidelity represents this big disruption, or the revelation of infidelity represents this big disruption in people's sense of what's normal, in people's sense of what can I expect, in people's sense of I think I know who you are. I can predict your behavior. I know who you are. And as a result, I can predict my own behavior and I know who I am. I know what this couple is all about. I know where we're going. I can predict where we're going to be tomorrow.
Yeah.
When that's disrupted, when that's disrupted, now what do we do? Now what do we do? Um, and one option is to say, oh, you are unfaithful. I know what that means. I know about people who cheat. There's that social media thing, right? Or what you learned from your older sister. I know about people who cheat, and therefore, blah, blah, blah. Rather than, hmm, this is a surprise. Can you please tell me a little bit more about who you are, how you made this decision, what were you thinking, how did you think I would respond if I found out? Be more curious. And similarly, the person who had the affair, they need to be more curious rather than, oh, you're one of those people who got cheated on. Now you're going to be like this, you're going to be like that, you're going to punish me, you're going to do. No, 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 slow down.
Hmm.
You're not married to a member of a category. You're married to a unique individual in the history of the world. When
Hmm.
there's any sort of disruption, chronic illness, somebody breaks into the house and, steals your stuff, whenever there's a big disruption, people need to be more curious about each other because this is an opportunity to learn more about the other person rather than assuming you know everything there is to know about that other person.
Yes, for sure. Um, no, that's such a good point. And then why do you say that total radical disclosure by the betrayer, a common requirement by many therapists after infidelity is disclosed, is typically a mistake?
It's a horrible idea. Oh, it's a terrible idea. It's a terrible idea. And by the way, when I was in training thousands of years ago, this was not a typical clinical strategy post infidelity. This is a relatively new thing, and the idea is that the person who's been cheated on, they need to reestablish trust. Yeah. And the way to reestablish trust is to tell them every single thing that you can possibly think of and every single thing that they can possibly think of. Not just, who did you cheat with? Who did you cheat on? Who did you cheat with me on? Not just who did you sleep with, but also, so how long has this been going on? That's a reasonable question, right? Are you in love with this person? That's a reasonable question. These kinds of questions, they help you understand what's going on, and they help you understand who is this person that you're in a couple with, and how did they
Mhm.
make their decision. Okay, when you start getting into which restaurants did you go to together, or what music were you listening to while you were having oral sex, that just gives the person who was cheated on a lot of stuff to obsess on. And
Yeah.
it gives that person the chance to say, oh, you went to that Chinese restaurant on Main Street with her. Well, I'm never going to go with you to that restaurant ever again. Well,
Mhm.
that's an unnecessary loss.
Yeah, and unnecessary triggers too for everyone.
So, and my observation is that once people feel it's legitimate to say, okay, what, which hotel did you go to, or how many minutes did you spend going down on him, or once people get a sense that those kinds of questions are legitimate, that opens the door to what underwear were you wearing when the two of you got, and there's just no limit to those kinds of questions. And people say to me, well, if I'm going to reestablish trust, I need to know everything. And my response to that is actually that's not the way that trust works.
Hmm. Hmm.
Trust, trust is belief in the absence of facts. Trust is not, I have all the facts in the world. That's not trust. Trust is when you believe in the connection without knowing every single thing. Why would a person do that? Because you know that person really well. So let's get to know each other really well. That's what the revelation of infidelity or any other major disruption, that's what it's an opportunity for. It's a chance for people to get to know each other some more.
Yeah, definitely. And then what's the biggest mistake people make after their infidelity has been revealed?
Well, this demand for radical transparency, and by the way, giving into that demand, when because there are people who say, "Okay, I'll tell you anything you want to know, just please don't leave me," or "I'll tell you anything you want to know, just please don't tell my sister," or "I'll tell you anything you want to know, just please resume having sex with me," and I will step in there and say, "Wait, wait, wait! This is too important a decision to make so quickly." And just as a way of let's reduce the temperature here a little bit. Reducing the temperature in the room is not my goal. And I know for younger therapists, all of that emotion, all of that heat can be a little scary. I remember being a young therapist thousands of years ago, and I remember, oh my God, these people are really upset. Like, am I going to be okay? Uh,
Yeah.
and my message to younger therapists about this sort of thing is don't be afraid of the heat in the room. Do not be afraid. Let people get really upset. And you don't need to throw a blanket on the upset. You don't need to put a ceiling on how upset people get. You know, as long as they're not throwing things at each other or me. Uh,
Importantly.
I don't have a lot of knickknacks laying around the office. I don't want. anybody having something that they can pick up and throw,
Yeah.
except for the tissue box, and it's a small tissue box.
Small and light.
So a lot of times people are willing to do anything just to get the other person to not be upset. And I say, you know, this upset is not necessarily something to minimize. This upset is instructive. This upset that the other person is feeling is a chance for you to really hear and experience what's going on with them. And I think for both betrayers and betrayeds, I think it's valuable to have that kind of access to each other's feelings. And um, the idea that uh, I know now that I know that you are unfaithful, I know everything about you that I need to know. That's a mistake. And the
Mhm.
idea that it's true, I was unfaithful, but I promise I'll never do it again. I swear to God, I'll never do it again. So can we just sort of like move past this? That's a mistake too.
Try not to think about it anymore.
Right.
Totally unrealistic. And then in what ways is your clinical approach to infidelity somewhat different than many other therapists?
Well, as I already mentioned, number one, I I interrupt anybody's desire for radical transparency because it's just not helpful. So that's the first way that my approach is different. Um, a second way that my approach is different from some people is um, I don't assume that the goal is for the couple to reconcile.
Hmm. Yeah.
What couples need to do is they need to talk about, okay, if we reconcile, what's our vision of what couple we want to create?
Hmm.
Because if they love each other and they want to reconcile, but she wants to have sex twice a week and he wants to have sex twice a year, just because they love each other, that doesn't mean it's going to work.
Yeah, it's not compatible.
Or she wants to be in a couple where we each have lots of space, and he wants to be in a couple where we talk about our feelings all the time. We talk about our day, and we talk about our hopes and dreams and fears. Um, that couple may not be compatible. So before they agree to reconcile, I need for each person in a couple to acknowledge to talk about what's your vision of what you want this couple to be. And both people talk about that, and then it's out on the table. And then people can say, is reconciling really going to work here?
Hmm.
We love each other, but that's not nearly enough. That's not nearly enough.
Yeah.
So that's another way I think in which my approach is different. If people want to reconcile, mostly they don't want to go back to the old couple. At least one of them, if not both, wants
Hmm.
a different kind of a couple right now, or wants certain issues resolved, like are we going to have two children or three children? Or is this going to be a home where our friends come over unannounced? Or is this going to be our little sanctuary?
Hmm.
Or do we believe in spanking our kid? Or how often do I want your mother to visit us? So
Hmm.
this disruption before people agree to reconcile is an opportunity to renegotiate the couple's contract.
Yeah.
Scary, yes. A lot of work, usually. And as far as I'm concerned, it's the only game in town. If you're going to reconcile, now's the chance.
Hmm.
See, is there one couple, one relationship that we both want to have?
Yeah, rebuilding a new foundation. Um, okay, great. And then going back to two questions ago, you had mentioned younger therapists and yeah, sometimes the fear of high conflict couples. I guess what would you tell your younger self about working with couples? What would that be now with the experience that you've had?
Oh, let's see. My younger self. Well, just have a lot more experience at your age.
It's gonna be hard.
It's impossible, which is impossible. What I would tell my younger self is um, be more patient, ask more questions, say fewer things,
Mhm.
ask more questions. Um, don't don't worry that people are going to quit therapy.
That's an important one, definitely.
Um, if you've ever been in a relationship where you were afraid the other person was going to leave you, I mean, we've all been in one relationship like that, hopefully only one. But if you're afraid that the other person is going to leave the relationship, it just constricts your sense of self, and it constricts any risk taking or any curiosity or any experimentation, or it's just no way to live. It's the same
Yeah.
thing in therapy. If we're too worried that our patients are going to say, well, I'm leaving, it just constricts us. And paradoxically, the more we're afraid that they're going to leave, the less we can do high quality work with them.
Yeah. The
And
more likely they will leave. Yeah.
high
Yeah.
quality work requires that we take lots of risks. We ask questions where we don't know what the answer is going to be.
Mhm.
We challenge people without realizing that, oh, that's like a really fundamental thing that we just poked at. If we are not willing to take those kinds of chances, we can't possibly deliver high quality therapy. So what I would say to my younger self is be a little bit more fearless, take a few more chances, ask more questions, and don't feel obligated to have the right answer to everything. Oh, and one more thing I tell my younger self: when patients ask me a question, I always have the option of commenting on the question rather than answering the question.
Mhm. That is very helpful. A lot of our participants will be newer therapists, so I think that they're good reminders to have.
Oh, good. Shaping young minds, my favorite.
That is what you're here to do. Well, thank you. Thank you for this. I'm really excited for your training. And really, I'm looking forward to it.
Thank you, Millie. I'm delighted to have 3 whole hours with a group that you've told me is a pretty fine group of therapists. So I'm excited too.